Hello and welcome to BOOBSBY, your favorite plastic surgery show. My name is Amadej Lah and today we are speaking about something else. As I promised yesterday, I and you probably also have enough of boobs. So let's start to talk about the face, about the aging face. As always, please follow me on my Instagram. Subscribe to this channel to be up to the updated about the latest that is going on my YouTube channel. So about the face and aging, there is many factors that influence the aging of the face, but the two most important factors are, first, intrinsic factors, that are the factors that are inside our bodies. That's mostly genetics, and it's probably one of the most important factors, but it's something that we cannot change, that we cannot influence. We cannot change our DNA, so nothing to do about that for now. There is research about that to reverse aging process and reverse DNA damage, but maybe we'll speak about that some other time. And the second group of factors are extrinsic factors. That are the outside factors that we can actually change. Those are first, of course, a very important sun. Sun does a very bad damage to our skin and is one of the most important factors of aging and skin aging, of course. Then smoking is the second most important. Smoking, of course, with all the radicals, all the ischemia, damages our skin cells, damages our collagen, our elastic fibers, and promotes aging. Then the third is the hormonal state of our body. Especially use of some hormones can change the process of aging. Then, of course, diseases are a big factor, a very important factor, and last but not least, of course, the weight change. So, of course, losing weight will, of course, influence how we age, how our face ages, because of the extra skin, of course. When we are speaking about aging of our face, it's more or less speaking about two things. One is the superficial layer, let's say about the skin, and the other are the deeper layers of our face. That would be the dermis. So the dermis is the deeper layer of the skin, where the collagen fibers are, where the elastic fibers are. And of course, with process of aging, those fibers lose their volume, lose their quality, and it of course leads to aging. Second, is the subdermal fat. It's the fat tissue in our cheeks, also of course in other parts of the body, but now we're talking about face. It's not, I mean, cheeks, lips, everywhere where the fat is. During the process of aging, the fat gets redistributed, so some parts lose the amount of fat, some parts might gain it. It's mostly loss of fat. Then there's the muscles of the face. With age, like all the muscles of our body, they age and they lose their tone, they lose their strength, and that also of course influences the aging. And the deepest layer is the bone, which is probably one of the most important factors in aging. Bone changes with age. In some areas it gets retracted, so in some areas there is less bone, which would mean less support for the superficial layers, and in other areas the bone grows, and that also makes or leads to the distinct aging signs. If we are looking through the decades of aging, how we age, then the first sign of aging are visible in our 20s, when we start to lose our fat. So first we're losing our fat, so our cheeks get smaller, actually narrower, and also some wrinkles appear. The first wrinkles to appear are the so-called crow's feet. That are the wrinkles around the eyes, which are caused by orbicularis muscle, which actually squints the eyes. That are the first motor wrinkles to appear. They are caused by the muscles, so they are called motor wrinkles. This is the age or the decade where there is usually no need for some drastic approaches for anti-aging. No need for surgery yet in most cases. Just maybe minimal need for some Botox and fillers. We will speak about Botox and fillers tomorrow. So the skin care in this period in the 20s should be towards sun protection, so good sunscreen with high factor. Then of course use regular usage of moisturizers, so face cream, skin cream that nourishes the skin, and of course use of light pills, so some chemical pills that clean the superficial layer of the skin. The skin by itself, the superficial layer, is in this age, in 20s, is still very, very radiant. Radiant means that it has no superficial irregularities. It's smooth. It makes a nice light reflection. It does not have any pigmentations yet. They appear later with aging. So the radiance of skin is very important in this decade. And then we are moving towards the third decade of our life. So in the 30s, some more visible irregularities appear. The skin becomes tired, less radiant. There might be some superficial irregularities, some pigmentations, and other typical wrinkles appear. One is the famous number 11, which is here in between. You can see it on my forehead, between the eyebrows. Then, of course, there are the nasolabial folds, which are the folds that follow from nose down to the angle of the mouth. So nasolabial, this, yeah. We also start to lose our cheek fat, which is the fat in the cheek area. So the face is getting narrower in this area. And the things to do in this decade is, we're of course to treat the superficial layer as the decade before. Use light creams, nothing extremely aggressive, and use of course chemical pills to clean the skin, to remove the dead tissues, the dead cells on the outer layer. And in this decade we usually recommend to start using Botox and fillers. Why? Even though they might not be really necessary yet, you just need a really small amount to have a really nice effect. And another thing is that Botox and HA, hyaluronic acid, in this period makes creates also this anti-aging effect. So the areas we treat age a little bit slower than the areas we don't treat. If we use Botox, the skin is more relaxed and has time or has a chance to regenerate. So moving into the 40s, which is my decade, what happens, of course, especially with smokers, lines around the lips appear. The vertical lines, some call it barcode lines, that are the vertical lines between the nose and the upper lip. This is more pronounced in patients or in clients with who have more sun damage, where the skin has less elasticity, and of course especially with smokers. Of course also lines of the forehead appear, like on my forehead, see. And of course, apart from that, there are the changes in the nasolabial, as I said before, and the glabella, which is this vertical number 11. What else? Of course, also the neck changes appear, especially in the women. Women hate changes of their skin in the neck area. Men usually don't even notice that, but it's something very, very annoying for women. You know, sometimes they come to me saying, "Oh, can you just please do something on my face?" And I said, "Okay, yeah, you have some lines on the forehead, around the eye, something like that. We do some Botox, some fillers, maybe a little bit of lips." No, 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 no. Don't worry about those. I want to fix my neck. And I said, "What's wrong with your neck? I mean, for me, it's completely okay. It's completely acceptable. But women are really fixed with the problem of their neck." So neck starts to show its first signs of aging, like horizontal lines, and of course also these vertical bands, which are more pronounced in the next decade. In this decade, stronger creams should be used, and of course also night creams to nourish the skin during the night, during the sleeping period. Botox and hyaluronic acid in this decade are a must. I mean, if you don't start in this decade, you're losing time, because, as I will tell you later, when you're 60, it doesn't work well anymore. So, when we are in the fifth decade, in the 50s, there is the hormonal change, especially in women, of course, also in men, but not so pronounced as in women. So, in the menopause, that changes the body a lot. There is a very, very quick or rapid breakdown of collagen and elastic fibers. The face starts to droop, to fall down, and then what happens is we get jowls. Jowls are these defects of the skin which is hanging like this, and the face becomes square. The skin gets changes, the superficial changes like discolorations, then different types of warts or pigmentations, or vascular problems like angiomas. Apart from that, of course, and the vessels become visible, redness is more pronounced, and the skin gets drier. The 50s and the 60s, as I told before, are quite late to start Botox and fillers. They do not work really well in these decades, and of course, I mean, we are different. Every person is a little bit different, but the time to start Botox and fillers is much earlier. And then when you continue into this decade, of course, it still works and it still does the job. But more importantly than Botox and fillers is the surgery. Much more important. Operations like blepharoplasty, where we fix the eyelids, then facelift, where we pull the skin, are much more effective than small ambulatory procedures like Botox and fillers. During our whole life, there are some other changes, but that you might not even notice. Our ears, they grow all our life, and the older we are, the bigger they are. And also the nose, it grows all our life. So even if we do nose surgery when you're young, it will grow and it will get bigger with age. I prepared some photos so we can see what changes happen during the aging process. Let me just move to the side and start the slideshow. So this is a young teenage girl, a beautiful girl. What you can see is that her skin is completely perfect. No freckles, no discolorations, nothing. And if you check her cheeks, it's really round and full. Another thing that is very interesting, and I would want to show to you, are the eyebrows. In young people, like this girl, the eyebrows are actually quite low. Everybody thinks that, or most of us were actually taught that eyebrows are high with younger people and then they drop with aging, and that's why some older women draw their lines, eyebrows very high. I mean, that's not true. Eyebrows are low when we are young, but you know, the things that different from young age and older age is the fullness of the upper eyelid. You see, it's very full, it's filled with fat. So, and the upper eyelid is actually almost invisible, and that's a sign of young age. Then when we progress to let's say 20s or early 30s, like in this girl, as I told you before, you can notice some wrinkles around the eyes, like here. Another thing is that, you know, here in the temple area, here, this here, you start to lose fat. So the temple area gets, gets more concave, not convex anymore. Apart from that, we can also see some of the nasolabial folds that are starting to form. Okay, going onward to our, let's say, 30s, early 40s. Like in this girl, of course, nasolabial folds are much more pronounced. They start to go down as the marionette lines. This is the marionette lines. Actually, the this way you can see this. This is the marionette lines. Around the eyes, we can see much more wrinkles here, and of course, she's losing the volume in the temple area. Typical signs of aging in the 30s. This is a very good time to start Botox and hyaluronic acid to fix these deformities, these signs of aging. Let's go on. This is a girl of similar age, let's say, also nasolabial folds. She has some signs of upper eyelid aging, like here you can see it's starting to droop. Some girls or some women, or even men also, of course, age with this with the drooping of the upper eyelids, and some age with loss of volume in the upper eyelids. The treatment is very different between the two. So in this case, she will probably need some sort of blepharoplasty. In the other case, they would need some sort of volume correction. But we'll speak about that some other time. Also here you can see the beginning signs of the vertical number 11 wrinkles starting to form. Otherwise, of course, a beautiful girl. When we go to the 40s or late 40s, you can see the number 11 lines here are much more visible already. Her upper eyelids are drooping, so it's this. Then, of course, she has also lower eyelid wrinkles, and that's about it. If you check the jaw area, the shape of the jaw is still quite round. You can see it's not actually dropping. It's still nice round shaped, because in the next period, okay, check her skin. That's one more very important thing. Comparing to the girls before, you know, you can see this superficial skin damage, which is of course a very important sign of aging. She has these hyperpigmentations, skin irregularities. The skin is not smooth anymore. It gets all these small wrinkles. You can see it's not hydrated well, and these are very normal or common signs of aging. Let's go on. So an older person like this lady, she's let's say about 70 or 80 years old. Well, here I wanted to show you this, the vertical lines on the neck, the turkey neck, some call it the turkey neck. These are the vertical lines that are formed by the neck muscle, the platysma, and it's forming these two, sometimes it's one, sometimes there are four vertical lines, and these are called platysmal bands. To treat this, usually we need to do some sort of surgery. Botox might help, but surgery is the way to go. Apart from that, you can see jowls. Jowls is this area, like I told you before, the skin hanging in the area of the neck, of the mandible, of the lower jaw. Apart from that, she's losing some volume in the upper eyelid. You can see here, so a volume loss here. And of course, she has all the possible wrinkles there are. Cream, even if it's called Curology, will not work. She needs surgery, she needs volume replacement, she needs skin tightening, and she needs some peelings, very strong chemical peels to correct the superficial skin irregularities. So if we check some famous people, they age as well. This is of course Penelope Cruz in her 20s. Her special thing, or her special whatever, is the upper lip. She has a very small distance between the nose and the lip, and this is her special feature, which makes her for me very attractive. As you can see, she's here. She's very young. She has perfect skin, nice oval face, full cheeks. Of course, let's say a perfect face. As she was aging, we can see she's starting to lose some of the fat in the upper eyelid here. The distance between the edge of the eyelid and the eyelid fold is getting bigger. It's opening. So that's one of the signs of aging. She is losing some of the volume in the cheek area. It's getting narrower, flatter. Then she has, of course, some nasolabial folds. Apart from that, still, of course, a very attractive lady. Oh, and check the neck. She already has some necklines here. You can see that, some necklines. As I said, a very attractive lady, even though she's aging. And so if you go on towards her 40s, you can see here, or maybe even more in the next photos, that she's losing more and more fat in the cheek area here. As I can see, she does not do much of filler and Botox, or she does it very conservatively. If we check the forehead, she has some horizontal wrinkles here and here, and some marionette lines, which are these vertical lines, some nasolabial folds like here. So she is slowly but aging for sure. Here, when she's speaking, you can see more pronounced forehead lines, because these are the lines that are caused by our mimic, our muscles. When we speak, we might use the forehead a lot, so these lines appear. And also see her neck, it gets the lines get more and more visible. There are other famous women like Madonna here. I just wanted to show because it's very difficult to show the aging process in certain ladies, especially like Madonna, who had, for my opinion, too many corrective procedures. She had a really skinny face. When she was in her 20s, like here, or even younger. So she was skinny, very slim face, and if you see her chin was quite pointy and quite narrow. Checking her later, now you can see her chin has become huge, because probably the trick here was to fill the chin area with fillers to correct the wrinkles, so they're not as visible. Well, of course, if we fill something up, the wrinkles are gone. They go away, but of course you fill something up and it gets bigger. So for me, this chin is a little bit overdone. Otherwise, of course, she's Madonna. She's always beautiful. And then there are, of course, men. Men also age. This is, of course, Brad Pitt. Brad Pitt in his, let's say, 20s or maybe early 30s. Perfect skin, very symmetric face. Some small wrinkles on the forehead, but really a nice face. He has a really strong chin, and he has a really strong jaw. These are two features of men which are really desirable. To have strong jaw. It makes a man more masculine. And if we see the same person now, it's like maybe 25, 30 years older, we can see all these features of men aging, you know. Forehead wrinkles, number 11 lines between the eyebrows, excess skin on the upper eyelid. He's, of course, a little bit gray. But you know, in men, it's very different to women. Men, even if they're aged a little bit, they still look good. This is lucky for us. We get more actually handsome, more charming. I would say that, or many would agree with me that he's actually, if we check back and see now that he's getting better and better. Men are like wine, getting better with age. And there is one more man that I would like to show that also is getting better with age. Is this one? Oh yeah, that's me. This is me like 20 years ago. As you can see, there is quite some difference, especially in the cheek area. I was really round in my face, but I always had this relatively small chin and the small jaw. And I mean, this is still left, but my cheek area has become much narrower than it used to be. Of course, it's good that I wear glasses because my upper eyelids are drooping like Brad Pitt's. So I will probably need some sort of surgery later on because otherwise I will not be able to see anymore. I also got wrinkles, as you can see here. Here's like perfect, flat, nothing. I also had wrinkles between my eyebrows. Of course, nothing there. So, but you know, looking at men as Brad Pitt, looking at myself, I'm quite happy with my face. Even though I'm 25 years older, I think that men age well. So some of us are getting better with age. Okay, that's all for today. Thank you for watching. If you have any questions, please let me know. Tomorrow I will speak about the Botox and fillers. So what we can do to correct these old faces, to make them maybe not younger, but more relaxed, more healthier. I mean, just better to look at. I mean, it's not that we would want to make people younger than they are. Also, our patients, people do not want that. They say many times, they say, please don't make me look younger. Just make me more relaxed. Make me like I have slept well for 3 days. That's the effect I want. So when I see other people, they say, oh, you're looking so good. Did you sleep well? Did you have a good time or something like that? I mean, people do not want to change their age, most of them. Okay, thank you for watching and see you tomorrow on BOOBSBY YouTube channel. Thank you and bye-bye.